CBS 17 News, tracking coronavirus.
The first doses of the Johnson & Johnson vaccine arrive in the Triangle.
That is extremely exciting.
Thousands of people in Group 3 get their chance to get vaccinated.
This is at least we've got a path to the light at the end.
Plus, we're getting answers to your COVID-19 questions.
Will there ever be requirements in place to encourage people to get the vaccine?
How it would affect us long term.
When can I stop wearing my mask at school?
Coming up next on CBS 17 News. 1 year ago today, we told you about the first confirmed case of COVID-19 in North Carolina. Thanks for joining us. I'm Angela Taylor. 365 days later, the state reports nearly 900,000 cases and more than 11,000 deaths. But there is hope. More than 2.5 million people here in North Carolina have gotten the vaccine, and more than 800,000 people have recovered from COVID-19. Now at 11, we're tracking where we started and where we are by getting you answers about the virus and the status of the vaccine.
Just the timeline, the specific timeline for the vaccines and when they're going to be available for everybody.
Now, that's a question a lot of people have. Today, teachers, child care workers, and the rest of Group 3 lined up all over central North Carolina to get the COVID-19 vaccine. And unlike some of the vaccine stories we've been hearing, today, for the most part, was smooth sailing. CBS 17's Mackenzie Stasko is live tonight getting answers about how things went. Hey, Mac.
Hey, Angela, from what we've seen, day one of Group 3 vaccinations is off to a pretty good start. As you mentioned, thousands of essential workers, police officers, grocery store employees, and food service workers all able to get their first dose today. After nearly a year of being on the front lines of the pandemic, essential workers are now able to get the vaccine.
2020 was a rough year for our entire industry, so it's great to be able to get this new group in and started on this road to recovery.
Some counties started vaccinating essential workers earlier this week, but Wake, Orange, Durham, and Johnston are a few that opened appointments to them on Wednesday.
I was really excited. I do have family members that have already gotten the shot. I do have family members that have already had COVID.
It's really nice to be here and know that teachers have also got their vaccinations so that now we can get ours.
Moving forward, how quickly will you be able to get yours? Wake Med had appointments available for next week, but when I checked online, Duke and UNC Health were already booked. Walgreens did have a few spots available in Roseville and Fuquay Arena, but within minutes, they were filled. Joanne Pezza says she's grateful she was able to get one before they were gone.
And I was not going to wait around picking and choosing which one I wanted. When it became available, I made the decision to come get it.
And just like the hospitals, the wait at county health departments really varies by the week and ultimately depends on the shipment of vaccine supply. The Wake County Health Department tells me if doses stay at the level they are, the wait for appointments here in Wake County could be just a few days. Live in Raleigh, Mackenzie Stasko, CBS 17 News.
All right, Mackenzie, thank you. Now, one question people keep asking is, what group am I in? So let's break down who's eligible now to get the vaccine. People in groups 1, 2, and 3, those are healthcare workers and long-term care facility staff and residents, as well as adults 65 and over. Now, group 3 includes teachers and daycare workers, as well as other frontline essential workers in manufacturing, food and agriculture, government, and community services. If you still have questions, just go to the CBS 17 News app, click on the coronavirus tab, scroll down until you see the Find My Spot banner. Click on that. Just answer a few questions, and it will tell you what group you're in. As more people get vaccinated and things start reopening, Chris Nickerson in Wake County has a question he wants answered.
When will I ever be able to go back to a restaurant? I have missed restaurants.
Don't we all? The stay-at-home order is over, and now you can go inside restaurants and bars, but at reduced capacity. New at 11, CBS 17's Amy Cutler getting answers about how restaurants and bars are working to get back into business. Amy.
Angela, and it is no easy task. Restaurant managers and hotel owners that I spoke with today tell me this past weekend was a really good one, and it is giving them hope that things might be finally starting to turn around. What started as a grocery store 90 years ago, the 42nd Street Oyster Bar remains a popular Raleigh restaurant. Still being closed for 2 months wasn't easy. They had to furlough their 90-plus employees. The Paycheck Protection Program helped.
We kept as many people on that wanted to come back. They just not as many shifts.
Ryan Tyson is the wine and beverage manager there.
It was a slow start. Now, the last month or so, business has really picked up.
Enough so that Tyson tells me they're looking to hire another 10 servers. That would bring them to where they were pre-pandemic.
I'm very thankful that we're in that position.
We opened our hotel March 20th and wound up closing on March 24th.
A big blow for Origin Raleigh, a new hotel in a new building on West Morgan Street. They reopened June 1st. General Manager Todd Butchko admits it's been slow, but easing restrictions, mainly the curfew being lifted and the ability to serve alcohol at their restaurant until 11, gives him hope.
It's night and day. It really is. That 2 extra hours that we get has definitely increased our revenues.
The hotel also picking up on weekends.
We are starting to hire, so we're hiring servers, bartenders, and cooks in the kitchen.
Now here at Origin Raleigh, to put it in perspective, when they first reopened, they only had managers working. Now they have about 15 employees. Ultimately, they are hoping to double that once things finally pick up. Live in Raleigh, Amy Cutler, CBS 17 News.
Amy, thank you. Now, a lot of people want to know if they can take time off work to get the vaccine.
My question is, will there ever be incentives or requirements in place to encourage people to get the vaccine once it's available?
Now, some employers are offering workers paid time off to get the vaccine, and companies like Target, Trader Joe's, Dollar General, and Harris Teeter all offering a one-time bonus for workers that get the vaccine. Just check with your employer to see what, if any, incentives are available to you. And tonight, governments and businesses are considering a way for people to prove they've been vaccinated against COVID-19. The so-called vaccine passports could determine who can travel, stay at a hotel, even visit a bar. Israel already using them, and the European Union just proposed them. Now the U.S. still considering this. So Doris from Raleigh wants to know, when will it be safe for her to go to St. Louis to visit her grandchildren? So Doris, CBS 17's Maggie Newland is live tonight getting you answers about how to travel safely. Maggie.
Angela, the CDC is expected to issue guidance this week, possibly as early as tomorrow, about what people can and can't do once they have been fully vaccinated. This guidance is expected to include recommendations about travel. Now, we all know right now it's considered safest to stay home, but I spoke with a local doctor about what you should know before you make a trip.
While we can minimize risk of travel, it's still not zero risk.
If you need to travel, WakeMed Dr. Christopher Chow says you can reduce your risk. We wanted to know, should you take a car or plane to your destination?
I think driving has some advantages in that you control your environment.
The more people you come in contact with, the greater your chance of exposure.
When you get in the car, you still have to go to the gas station, you still have to eat. So that it's not 100% contact free, but you can control that environment too.
But you can't drive everywhere.
I think the airlines have actually done a very good job. The way that the cabins are designed for airflow, it's actually pretty good for preventing droplet transmission. You're also not directly seated face to face with another traveler, and everyone is required to wear a mask.
We also asked what kind of activities are safest.
Outdoor activities are probably safer. I think the risk when you're dealing with skiing, with running a race, is what you do before and after. You go and hang out by the fireplace in the lodge, or you go eat out with other people. That's where the risk lies.
And what if the place you're visiting has different rules when it comes to COVID?
We recently went to a part of the United States where there was no mask mandate. I wore my mask. Wore my mask because it's the social responsible thing to do. But number two, I'm minimizing the risk to others around me. I'm also minimizing risk to myself.
And of course, it will be quite a while before everyone can get vaccinated. Again, the CDC is still advising against travel right now, but if you do need to travel, the agency has a very extensive list of recommendations on its website, and we have a link on our website, CBS17.com. Live in Raleigh, Maggie Newland, CBS 17 News.
All right, good advice there, Maggie. Thank you.
It's 5:25, and it's been 1 year since the first reported case of coronavirus here in North Carolina.
Yeah, all day long we're answering your questions about the virus, even those that come from some of our youngest viewers, like Hadley Hampton.
When can I stop wearing my mask at school?
Hadley, how cute are you? I'm sure a lot of kids, Bill, want answers to that question. So, Hadley, I want to thank you for weighing in, giving us your question there. The CDC says, though, in order for everyone to stay safe while at school, you, your friends, older students, teachers, everyone still should be wearing their mask and keeping their distance.
Right now, no one knows just when the mask requirement's going to go away, but the experts say wearing a mask does help protect people from getting sick.
So hang on there, Hadley. We've got to wear it for a little while longer. And then, of course, remember your 3 W's. Wear your mask, wash your hands, wait 6 feet apart from other people. And we want to say thanks for watching and have a great day at school today, Hadley. You're awesome. Bill Ray?
Hello, my name is Philip Woodward, and I want to know how you will communicate with deaf and hard of hearing people while wearing a mask.
Yeah, Philip, that is a great question, and one we've gotten a lot since the mask mandate went into effect. So we asked the State Department of Health and Human Services and found out the Clear Mask program is still available in North Carolina. We put a link to the DHHS program in our COVID-19 Getting Answers section on CBS17.com. As state leaders work to get more students back into classrooms, a lot of teachers and parents have concerns.
I would ask them if it's going to be safe for the kids to go back to school, because my son is supposed to be going back to school soon, and I just want to make sure that everybody in our family stays safe.
So Vanessa, here's what the state is recommending. K through 12 schools are expected to open for in-person instruction using the Strong Schools NC Health guidance that was released today. That means schools should open to in-person instruction while still maintaining 6 feet of social distance for middle and high school students. The State Board of Education will vote tomorrow on whether to adopt that update.
Well, it's been 1 year since North Carolina reported its first case of COVID-19. Last week, Governor Cooper relaxed restrictions, and that sparked a lot of questions like this one from parents.
I'm Diana from Raleigh. I'm a mother of 2 children, one in 4th grade and one in 5th grade. Right now, they are in a 3-week rotation, and I'm really just wondering when it'll be safe for them to go back full time, and if that'll be before the end of the school year.
Hi, Diana. Thanks for your question. So right now, that's up to each individual school district. And last night, the Wake County School Board announced it's now considering a plan that would bring grades 4 and 5 back to the classroom every day as early as March 15th. Now, school officials say this consideration is based on decreasing COVID-19 infection rates, an increase in vaccine availability, and the overall success of daily in-person instruction they have already seen for pre-K through grades 3, which started last month.
We should not pretend, however, that we are returning to normal, because we are not. Children will still need to be screened every day. Face coverings continue to be mandatory. COVID coordinators will still be present in every school. Eating and drinking guidelines are still in place.
Now, the Wake County School Board is set to vote on this issue next Tuesday, March 9th. If approved, your 4th and 5th graders will head back to school for daily in-person learning come March 15th. The district is still considering plans to increase how often 6th through 12th graders are back in person. And an important note here, this decision would not apply to students in the virtual academy.
A year ago today, our state reported its first case of COVID-19.
And many of you do still have questions like this one about medications and the vaccine.
Some things I've read that it's not great to take Tylenol or ibuprofen before the shot because it reduces the effectiveness of, like how well you're protected. So that would be my question. When is it okay to take Tylenol or ibuprofen?
So can pain relievers or prescription medications interfere with the vaccine?
CBS 17's Maggie Newland went to UNC to get answers for you.
UNC doctor Anita Scaria says it's okay to take a pain reliever if you're experiencing side effects after the COVID vaccine. But the key word is after. She says taking a pain reliever before your shot to try to prevent symptoms is not a good idea.
Theoretically, it may actually be blunting the immune system's response to what's happening.
What about afterwards if you start to feel bad? Should you try to tough it out and not take the drugs if you don't need them?
Well, so what I'm telling people, so if your arm is sore, take a cool compress and put it on there, see if that will help it. Move the arm around a lot because that seems to help. If you're mounting a temperature or fever, not feeling well, then go ahead. You can take some Tylenol or Motrin if you need to.
If you regularly take aspirin or another pain reliever to treat a medical condition, though, that doesn't mean you have to stop before you get the shot. In that case, you need to talk to your doctor. Some of you also asked about prescription medications. Do any interfere with the vaccine?
My name is Jeff Luxon, and I'd like to know, are there any prescription medicines that we should stop taking before getting vaccinated?
Dr. Cindy Gay, who leads some of UNC's vaccine trials, says the only medication that might impact vaccination would be a medicine that suppresses the immune system. It's not a safety concern, but those medications may decrease immune response to the vaccine. If you are taking immune suppressants, she says it's still useful to get the vaccine, and perhaps even more important. Maggie Newland, CBS 17 News.
All right, Maggie, thank you again. It's always best to talk with your doctor if you have any questions or you have concerns. Right now on CBS17.com, you can find answers to more common questions like, is the vaccine safe? And do you have to wear your mask after getting the vaccination? A lot of good stuff. Just head to our website right now. With more and more vaccine shipments arriving in North Carolina, some of you are asking if your employer can make you get the vaccine. Tonight, consumer investigator Steve Sbragia takes that question and gets an answer.
Teachers like these in Granville County are voluntarily getting the vaccine, but it is not a mandated condition of employment. But one of our viewers, who asked that I not use his name, has been told by his employer that a COVID vaccine was mandatory, and if he didn't get it, he wouldn't be allowed back till after the pandemic ends. He wants to know if it's a rule or law and if employers can mandate it. It's a question many are pondering.
I don't guess you should try to make someone get it. You should suggest it.
If you don't want to get the shot, you can get a job somewhere else.
In general, can an employer mandate that somebody take a vaccine?
It's an interesting question, Steve. What we're seeing is that most organizations are not mandating that the vaccine is taken.
Molly Hegeman is with Catapult. That's an employers organization serving 2,300 companies.
The viewer that wrote us the letter said his company says that they have to get the vaccine at this point, and if they don't, they could be disciplined or even terminated.
Yeah, so companies who are doing that, I think there's a couple of cautions there. One of which is there could be some reasons why an employee may not choose to take the vaccine that would be protected under the ADA.
For more on that, I turned to the North Carolina Department of Labor, which told me that it has no jurisdiction regarding employers requiring that employees receive vaccinations. It pointed me toward the Equal Opportunity Commission website, which said an employer may incentivize employees to take the COVID-19 vaccine and that an employer may mandate that staff take the vaccine. However, the employer must provide accommodations to employees under the Americans with Disabilities Act.
You could fire people for any reason. Is that a good choice right now, just to say somebody's not going to take the vaccine? Probably not.
And in 6 months, all of this could change as vaccine supplies become more available. In the meantime, if you want to see what the EEOC says about all this, I've included a link in my web story. Working for you, I'm consumer investigator Steve Sbragia.
All right, Steve, thank you. And still to come, what you need to know after you get your vaccine. And right now on CBS17.com, you can find answers to more common questions like, is the vaccine safe? And what are the side effects? State health officials confirming North Carolina's first positive case.
We've been preparing for this, and we do expect to see more cases in North Carolina. After alarmingly high numbers, we've reason for hope in North Carolina. Fewer people are getting sick. Fewer are needing a hospital. More people are receiving life-saving vaccines every day. Now is the time to put our strength and resilience to work so that we can continue to turn the corner and get through this pandemic.